Welcome to the channel Health, Balance, Wellness, your oasis of peace. If you often experience nerve pain, such as sciatica that starts in your buttock and radiates down your leg, or arm pain that starts in your neck and travels down your hand, you may not be alone. These conditions can involve the fingers, such as the last two or even the thumb, and are not uncommon. Other common symptoms include tremors, which are especially common among older people, as well as a persistent feeling of anxiety or a constant state of alertness. There is no shortage of problems related to attention and concentration. It was once thought that these only affected children, perhaps distracted at school, but today it is increasingly evident that they involve people of all ages. Obsessive-compulsive disorders, difficulty falling asleep, insomnia, restless leg syndrome, breathing problems, and difficulty performing physical efforts are other manifestations that can have a common origin. Some feel dizzy, have difficulty maintaining balance, or experience vision problems, especially if they suffer from diabetes. The surprising discovery is that many of these symptoms could be linked to a simple, but underestimated, nutritional deficiency. In the past, it was quite rare for this deficiency to occur, also because a rich and balanced Mediterranean diet was more frequently followed. Today, however, the situation seems to have changed. Several studies indicate that between 10% and 25% of the Italian population could have insufficient levels of a fundamental vitamin. Those most at risk are those who suffer from gastrointestinal disorders that compromise the absorption of nutrients, or those who follow an unbalanced diet. Before going on, I ask you for a like to support our work. But let's get back to the video. The vitamin in question is vitamin B1, or thiamine, a substance essential for the proper functioning of the nervous system, among other things. There are several factors that can contribute to a deficiency. One of the main ones is alcohol consumption. This substance, in fact, hinders the absorption of B1 by the body. Thinking about the current context, it is easy to realize how widespread the habits are that can lead to this imbalance. An example: food choices. More and more people are choosing brown rice, thinking it is a healthier choice than white rice, or preferring bread and pasta made from whole grains or ancient grains instead of refined flour. Although these may seem like good options, without a balanced diet they can paradoxically contribute to a vitamin B1 deficiency. Age should not be overlooked either. As we get older, our sense of hunger can decrease, meals become less regular, and the risk of deficiencies increases. Another sign that shouldn't be ignored is slow gastric emptying. In conditions of deficiency, the stomach takes longer to empty, and this can cause symptoms such as dizziness and even fainting. Prolonged use of antibiotics can also have a negative impact, as can chronic stress, a condition that creates a vicious cycle in which anxiety worsens the deficiency and vice versa. In short, if you are an older person, with a reduced appetite or who tends to skip meals, you may be exposed to this risk. The same is true if you eat a diet rich in refined sugars, white bread and pasta, or if you frequently consume sugary carbonated drinks. Excessive alcohol or coffee can also aggravate the situation. So what to do? The first step is simple but crucial: talk to your doctor. A blood test can tell if your vitamin B1 levels are normal or not. If not, you can intervene quickly to prevent the symptoms from worsening. The second phase consists of adjusting your diet, eliminating substances that hinder the absorption of thiamine. So be careful to limit alcohol, refined cereals, and excess caffeine. But what should you introduce instead to increase the levels of this precious vitamin? Among the richest foods we find nutritional yeast, a very versatile ingredient, often used in cooking as a substitute for cheese to season pasta. In addition to containing high doses of B1, it has interesting properties for health, so much so that some consider it a true superfood. Another food group that should not be overlooked is that of green leafy vegetables. Now universally recognized as beneficial to health, they are part of the daily diet of the longest-lived populations on the planet. To these are added legumes, a pillar of a healthy diet, and then sunflower seeds, dried fruit and whole grains, to be consumed every day in at least 3 portions. Sprouted seeds are also highly recommended, as they represent a concentration of nutrients. This overview allows us to understand how a condition long thought to be rare, such as vitamin B1 deficiency, is becoming more widespread again. Modern eating habits and a hectic lifestyle can contribute significantly to this return. In the presence of foods and drinks rich in simple sugars, caffeine and alcohol, the risk becomes concrete. The symptoms that can arise are numerous and often underestimated: dizziness, a sense of disorientation, anxiety, hyperactivity, or even depression. The solution always involves a discussion with your doctor, who will be able to evaluate whether there are actually deficiencies and recommend the best way to intervene. On a practical level, this means adopting a more balanced diet, reducing substances that compromise the absorption of vitamin B1 and increasing the consumption of foods that contain it in abundance. Nutritional yeast, as mentioned, can be a great ally, easy to integrate into the daily routine and capable of offering benefits that go far beyond the simple vitamin intake. In conclusion, although often overlooked, vitamin B1 is an essential component for general well-being and in particular for the proper functioning of the nervous system. Paying attention to the signals that the body sends us, such as fatigue, mood swings or nervous symptoms, can make a difference. With greater awareness and a few small changes in lifestyle, it is possible to prevent many problems and improve the quality of life significantly. Remember that this video is created for informational purposes and should not replace your doctor. If you have any questions, contact your doctor. If you like our videos, leave a like, subscribe to the channel to not miss the next contents. See you in the next video.